Hello everyone, this is Dr. Wala. Today we're going to discuss how to perform an efficient case presentation to your supervisor before starting giving local anesthesia. So this video is for undergraduate students who are at their first year of the surgical round. It aims to give you brief information about how to present the case before giving local anesthesia. The whole diagnosis topic will be covered in upcoming videos. We'll cover shortly patient identification significance in terms of patient name and age, medical history, dental history, and final chief complaint. Patient name is significant for keeping conversation with your patient and at the same time distraction from a relatively painful procedure or reassuring an anxious patient. Later, the name is significant also for documentation and follow-up. The patient age gives you idea about the age-specific diseases and the normal reference values for certain conditions as hypertension, where the high readings differs between adults and old patients. Moreover, medication doses differ between different age groups. It also may indicate a marital status for a female patient without asking her, which is significant before asking as it's pregnant or not. As you see here, age is not just a number. Here, taking the medical history, you don't ask the patient frankly, for example, do you have any diseases? It's not a good question, but rather you should formulate the question by asking him, after greetings, how is your general condition? And if negative, you should start reviewing of system as you have studied maybe before. Review system or ROS, you should ask the patient systematically, do you have any problems in the heart, lungs, liver, kidneys? Shortly, systematically from top to two. And any previous operations gives you idea about previous health status, medication, and more importantly, blood transfusion that you should ask directly about if you have already performed a previous operation, as the significance of blood transfusion is the risk of hepatitis. By the way, you should treat all your patients as a hepatic patient and take your precautions not only for protecting yourself but also to avoid transmitting infection to other patients in future. Always remember that patient may go only for one dentist, but a dentist will receive a lot. And if you want to discuss in detail the signs and symptoms of hepatitis without patient telling you this information, leave a comment below and we'll discuss it later in details. Regarding medications, each medication or medical condition listed from a previous conversation have certain management precautions and or pre-medications or even complete referral to the patient for controlling the condition before you work to avoid any complications. As some patients worry about rejection from a dental treatment, so they may hide the information. Questions about medication is quite important also as it reflects the general condition, and some prolonged medications such as steroid require specific precautions before starting work. Regarding allergy, we'll discuss it with the dental history in details. Dental history is the previous dental treatment relevant to the current dental or surgical management, meaning that you shouldn't address the number of previous dental treatments such as operated cavities or restorations or endodontic fillings, as it's not significant, only may give you an idea that he took several local anesthetic injections without complication. The complication I talk about here is allergy. Here we jump to an important question. What is the significance of negative history of administration of local anesthesia? Meaning that it's the first dental visit. In such, you should leave a good impression to the patient about the dental treatment. The patient might come to you again or not come to any dentist at all. And local anesthesia is significant only when the patient have taken it once previously. and allergy usually occur on the second patient exposure for any agent, such as a local anesthetic agent, if he prones to develop it. So, if it's the second time he will take the anesthesia, you should ask the patient about presence of allergy from any kind of food, medications, and even skin allergy or asthma. If he have positive allergy, the patient should be referred to Vaxera for allergy test against the local anesthetic agent you want to give to the patient. No problem if the patient have multiple previous injections. Also, local anesthesia is not necessary to be an oral injection. It could be another extra-oral operation and can be counted. For extraction, history of extraction, you should ask the patient about any complication following the dental extraction, such as bleeding. The bleeding might be caused by patient incompliance to post-operative instructions or systemic disease. How you differentiate? If he doesn't follow the instructions, such as continuous spitting or irrigation following extraction, so it's local condition. Moreover, you should ask the patient about bleeding from any wound, if it's prolonged or within the normal range of stopping of bleeding. But most of the patients with bleeding systemic disorder have already diagnosed and will tell you from the fear of the post-operative bleeding. Other complications as difficulty in extraction, frequent fracture on each extraction, or even mandibular dislocation gives you idea about nature of bone or the condition and necessity of preoperative radiography and special management requirement for TMJ condition. Regarding chief complaint should be in the patient's own words, like patient reports pain related to the lower last area on the right side, or loose teeth, or swelling and pain in the face that he cannot sleep from, and he couldn't identify the tooth causing that pain. This is a chief complaint in the patient's own words. The scientific expression comes after the clinical examination and or other investigations as radiography to reach the diagnosis. History of chief complaint should be in terms of onset, duration, associating and relieving factors, etc., as discussed in details later in upcoming video. Treatment options should be discussed with the patient. As patients unaware of the endodontic treatment, you should give him all the options and guide your patients, because the most conservative treatment is much better to the patient. After addressing the chief complaint of the patient, you should correlate it with the clinical examination that include inspection to the chief complaint, intraoral and extraoral, palpation in the buccal vestibule for any swelling that might hinder the work of local anesthetics because of the inflammatory condition, and percussion. To sum up, presentation should be as follows. Mr. Blank, 25 years old, for example, medically free or controlled diabetic or hypertension, meaning that he's controlled on his medication and took his breakfast and having his medication with him for any chance of need. And it's first or the second dental anesthesia. He had multiple previous extractions without complications, and he complained pain related to whatever or loose teeth. And the clinical examination, the tooth is unrestorable or restorable, but the patient is unwilling for any other dental treatment option, as explained to him. Now, after efficient case presentation, you should go bring your tools for administration of local anesthesia. Thank you for watching.